Hello and welcome to the Functional Medicine Coaching Academy Recreation, Physical, and Occupational Therapist Industry Interview. I'm Elyse Wagner, co-founder and chief wellness officer for the Functional Medicine Coaching Academy. If you're wondering what additional impact you can make as someone who works in the physical, recreational, or occupational therapy realm, or what program would be best for you to continue your learning and how to decide. Maybe you're curious a little bit about how you can incorporate coaching into your current profession, you are in the right place. In this video, you're going to be hearing from a panel of 3 Functional Medicine Coaching Academy graduates / students who have a physical, recreation, or occupational background and are currently working in the industry and or health coaching. So thank you so much for joining us today. We have Jennifer Schmidt, who lives in the heart of the Canadian Rockies and is a functional medicine certified health coach, recreation therapist, and owner of Ignite Health Coaching and Wellness Incorporated. She graduated from FMCA in August of 2020, and through her own experiences with depression and anxiety, Jennifer came to use recreation therapy on herself and began training for triathlons. Although the exercise was helping, something was missing, and she sought support through functional medicine to ensure her body and mind were in top shape to perform in athletics and life. Her positive experiences led Jennifer to take her health coaching with FMCA, and she now combines health coaching and recreation therapy in her work with athletes to ensure a well-rounded lifestyle that supports training, competition, and life. Jennifer very specifically combines health coaching and recreation therapy with athletes in several areas, including a triathlon program for adults recovering from addiction and helping retiring athletes adjust to their new lifestyle. Jessica Mason lives in Nebraska and has 24 plus years experience working in the medical community as an occupational therapist in an inpatient rehabilitation setting. She graduated from Creighton University Allied Health Department for Occupational Therapy in 1997, and she is currently completing the FMCA program on course to graduate at the end of August 2021. Through her own health journey and discovering the empowering transformation of functional medicine in her own life, she quickly turned the focus from herself to outside herself and asked what could be done to bring this to her community. She saw the best fit for her was being a professional ally with people who wanted to be well. FMCA has prepared her to apply the tools and knowledge of functional medicine and coaching in order to make a difference in guiding clients to discover their own unique strengths and abilities to make lasting change in their lives towards health and wellness. Jessica will be transitioning to a more membership structured and community-based setting, starting out in the cardiac population with the vision of expanding to other demographics. She plans to be a collaborative member of a team of health professionals and supportive staff to guide clients towards health and wellness, decrease burden of physicians, and bring a community together to create a culture of health and wellness. Teresa Freeman is a nationally board certified health and wellness coach and graduated from FMCA in January of 2019. She also attended the Institute of Integrative Nutrition. Teresa is a licensed physical therapist and massage therapist, graduating from Northeastern University. Teresa lives in Falmouth, Maine, and has a private practice in Yarmouth. With 30 plus years of experience, she works holistically with her clients in person and by telehealth. Treatment focus is for a variety of health and wellness issues, including prevention, self-care, inflammation, and musculoskeletal issues of pain and or injury. Besides working with people one-on-one, she runs women's wellness workshops and community education programs for empowering people in personal health and wellness. Thank you so much for being here. Let's dig into some questions. So Teresa, we're going to start with you. Can you talk a little bit about your journey? What brought you to FMCA in the first place? And what made you choose FMCA? There's so many other programs out there, and you also already have done another health coaching program.
Thanks. So It's a good question. I started with the Institute of Integrated Nutrition. I was more familiar with that, and that was very exciting and got me motivated and inspired. But it also left me with wanting more, something maybe a little more medical, where I come from more of a medical background.
Mhm.
And I feel like I got that and more with FMCA. Um, one of the things that I surprisingly learned or deep did a deep dive into was positive psychology, motivational interviewing, and I feel like that was very, very beneficial with my practice and augmented it significantly with the coach approach versus the expert approach. So that was a super thing to dive into, and I think that's helped me significantly. So it's a fine dance between um, coach approach and expert approach, but it's been a nice addition.
Yeah, absolutely. Well, we're going to circle back to that question because there is a
Okay,
fine line there, and I want to hear more about that. So, but thank you for sharing that.
sure.
And Jennifer, how about you? What brought you to FMCA?
Um, I guess lots of different things. The holistic approach is one of the biggest things, but there is still lots of coaching programs out there that kind of hit on the same sort of holistic aspects. But similar to Teresa, it's kind of more of that medical piece. So a lot of the programs just didn't seem like, as I was reading through descriptions and things like that, it was like, okay, like, I took a ton of physiology and anatomy and stuff in school, and I feel like I'm not going to be able to actually use or apply those skills. And FMCA just really like, I remember reading it for the first time and being like, this is it. I was looking at coaching programs for like 3 years, and I was like, this one has enough of that medical thing that I can actually honor like my education and my skills and be able to apply that in a more medical setting. So that was kind of what really stuck for me.
Absolutely. Yeah, thank you. Thank you for sharing that. And Jessica, how about you?
Yeah, for me, as I said in the bio, I had some health issues and I kind of was trying to figure out a different pathway to health versus a lot of pharmaceuticals. And once I figured out and communicated with, a functional medicine doctor, I got to thinking, working in this environment of inpatient rehab and seeing the rise of these non-infectious diseases, I was trying to figure out how could I bring this to the community. So that led me to researching, different programs. I looked at IFM, I looked at coaching, and I really resonated with FMCA because number one, they had that partnership with IFM. So their curriculum was designed with these practitioners together with the FMCA staff. And so that resonated with me. And I really resonated with that coach approach. Working in inpatient, we have so much time to build a rapport. And I was kind of using it at some level, but the program and curriculum with the motivational interviewing and positive psychology just took it to the next level. And I felt like that was a perfect fit for me to be able to bring that to the community.
Yeah, I love that. And I think so many people can resonate with that. And if we could, I'm going to stay with you just for a second. If we can just go a little bit deeper, and can you talk to me? Because you're still going through the program. You're almost done. You're almost
Mhm.
there. But can you share a little bit about how this journey of going through FMCA has and really adding these pieces of the positive psychology, of the functional medicine, functional nutrition, of the motivational interviewing, the mind body techniques, how has that impacted you and where you're going, or if you have a current practice, just overall your career, your life? Do you mind speaking to that for just a few moments?
Yeah, sure. I mean, this whole program process has been a journey for me as far as self-discovery, and being mindful of some of those techniques as I apply it even in inpatient. One of the things I do is telehealth remote home assessments. So you're meeting these families for, the first time, and you have so much time to build that rapport, and you want to find out what's important to them. This is their home. So utilizing those techniques really has been beneficial for me. So
Yeah, thank you. That's wonderful. Thank you for sharing that insight. And Jennifer, how about you?
Um, Repeat that question for me one more time.
Can you talk a little bit? We're going to go a little bit deeper and talk about some of the benefits that you have seen or felt personally, or in your career, in your your practice, or just in your life in general from going through the program?
Yeah. Okay. I think personally, when I started, I had, I had it in my mind at the time I was working in addictions and mental health. And I had it in my mind that that was kind of where I was going to be using it, mostly like in the hospital and those kinds of things. But as an athlete, I started to notice, as you kind of play around with things as you're going through the program and apply certain skill, or like even like food stuff or mental things. And I started applying it more to my own stuff, and my performance just like skyrocketed. So I was like, maybe this has a little bit, maybe there's somewhere else that I can use this outside of mental health, which is really neat. And then I've actually been able to kind of combine the two of them professionally, which is really fun. Through, like you said, mentioned in my bio, with I work with an addictions and mental health program, but they also are doing triathlon, so that's their treatment. So it's really, it's a recreation therapy program, but I am actually health coaching in it and working with the lifestyle stuff. So it's really neat to kind of see where that can go, when you kind of where you least expect it to.
Yeah, absolutely. And it sounds like so far, from hearing from Jessica and Jennifer, I mean, both of you have had these personal experiences with functional medicine. And then you've been able to now transfer that and bring that to your community, which is beautiful. So thank you, Jennifer, for sharing. I want to hear more about that. It's so intriguing. Teresa, how about you?
Yeah, so when I think about benefits and opportunities that have come out of the FMCA program and training, a couple things. One is I feel like it's brought me a little quicker connection with clients and patients. So some of the thinking about open-ended questions rather than closed questions really gets more information from them, and they take you where they want to go rather than you assuming what they're coming in for with a diagnosis, or maybe just what you got on the telephone. So I think that's been really helpful. And then for like concrete opportunities, it helped me get more into the community with confidence and credibility. So doing programs with Maine Health here at connected with the hospital, so educating the community particularly about inflammation, and based on a book that I wrote and just finished it actually when I was in the midst of FMCA program, called Eat, Sleep, Poop. But it's basically, it's a silly name, but it's somewhat of a serious topic about inflammation and diet and lifestyle. So I base a lot of my talks on that. But I feel like the program added confidence, credibility, but also more information to give the book a little more meat to.
And I have your book because you gave it to me. So
Right,
thank you for
right.
that. I appreciate that. Yeah, that's wonderful. And Teresa, I'm going to stay with you a little bit. You started to talk a little bit about the coach approach versus the expert approach. And can you talk about that fine line, and maybe what kind of skills you've learned throughout the program that helps you to kind of flow, I'll use the word flow, in and
Yeah.
out of that, because you do have dual roles where
Right.
in some of your roles you are the expert, right? And then you have to
Right.
transition over and put that coach hat on. So can you talk a little bit about that?
I think about the coach approach is oftentimes the more open-ended questions where they get to tell me a little bit more about who they are, what they're made of. It's where I learn more about their character strengths, their lifestyle, and then I sometimes switch back to that expert approach. So I say, well, this is what I hear, and how would you like to start here? And then that's where I maybe create like a home program or something that may be more physical therapy related, but also dancing in and out of health coaching and giving recommendations, but with their input about what works for
Yeah.
them.
Yeah. Thank you. Thanks for painting that picture. I really appreciate that. Jennifer, how about you? Can you talk a little bit about that and how it works in your practice?
Yeah, absolutely. Yeah, it is a very, very fine line, I find. So similar to like Teresa said, in that kind of getting to know people stage, very, very good for the coach approach stuff. So just really asking those open-ended questions, getting to just kind of understanding what they're actually there for and what they want. I find, especially with new therapists, assessments are terrifying, and that's like the thing that I hear the most. And I remember being in that position too. It was just like, I need to learn how to do assessments, and so being able to actually use the coaching skills during assessments is huge. And I actually found I was learning and getting way more information out of my clients and my patients by using that. And then when, you know, at some point in time, because we're professionals, we do have to make recommendations around what kinds of treatment. But it's not just like, it's like we make the recommendation and then we're able to kind of use that coach approach again to like pull out how they're feeling, like how is this going to work for you, what does this look like, and you can kind of help to build that a little bit more with them, as opposed to just being like, okay, you're going to do this program 3 times a week, and you can really see how that's going to fit into their life and how that's going to work for them.
Yeah. So it sounds like you're really weaving these different roles in and hats in and pieces, and you're choosing specific parts and times of the time that you're with your clients, et cetera, to assume the role of expert and or coach. So that's wonderful. Jessica, what would you like to add to this conversation?
Yeah, as far as scope of practice, mine's going to be defined and separated. So I work in inpatient as an OT, but then the employer that I work for has this sort of health facility where it's a place where you're a membership, and it's separate from the hospital. They have a registered dietitian, they have a fitness director. So my role there would be more as the professional ally health coach, where I'm working in collaboration with this, team of medical professionals and supportive staff in an environment that's more of a non-traditional setting as an OT. And, the OT, as far as scope of practice goes, the self-care questionnaire, all of that resonated with me. And I feel like I'm going to be able to apply a lot of those OT skills in that setting as a health and wellness coach, and be able to assist those medical professionals like the nutritionist to be able to get that person to the next level.
Yeah, I love that. It kind of goes into our next question. So we'll stay with you, Jessica. As far as really differentiating yourself, how do you see yourself as this, as differentiated, as this more, valuable piece of the pie when you are working with other different, different types of practitioners, et cetera? Can you say a little bit more about that?
I think the first thing I like to say is that there can never be enough health and wellness coaches, depending on their background. And as far as the FMCA, I think my niche is having that knowledge of functional medicine. In a certain demographic, I feel it would play well to be able to communicate, educate the community. And then if there's a person that doesn't need a certain intensity level of health and wellness coach, maybe that fitness trainer who has that background might be a better fit. I'm not going to be that perfect fit for everyone. So I feel if we could just kind of have that mindset to all come together, that we all have a play in this, scheme of things, I think that mentality is going to play well.
Yeah, absolutely. Thank you for sharing that. Jennifer, how about you?
I think one of the biggest things that I noticed is that recreation therapists a lot of the time are kind of, we almost get put into a spot where we almost just cover all of the extra holes. So, you have like your PT is covering whatever the physical side of stuff, and your OT is doing certain things. And then they're like, you can teach the health class or whatever, like lifestyle courses. And a lot of therapists are really not comfortable with it. And I mean, but even before I took FMCA's course, I'm kind of a health nut anyway. So I felt like I had the information, maybe not quite as in depth, but I always felt like I was really stepping out of my scope by teaching these things, by talking about nutrition and by giving more information about, say, exercise or whatever. But now it's just, I know that that's in my scope. And I do talk to my clients about that, especially when I was working in the hospital. It's like, you know, right now I'm your recreation therapist, but I do have this extra training. So if you have questions, like please ask, as opposed to before it was kind of like, okay, I know as a rec therapist, I can only talk about this little box with that. And I didn't want to answer questions outside of that because it was really stepping out of my scope. So that just gives me a lot more confidence now.
Yeah, yeah, and it sounds like more expansiveness. You
Mhm.
can really help people in different ways.
Yeah.
So wonderful. Thank you. Teresa, how about you?
So if I just can recap the question, how you're differentiated from other practitioners, maybe other PTs or other massage therapists by having
Yeah,
coaching, right?
yes.
So
Mhm.
what I see it as having a little more of a broader scope to what I do and what I offer. So a little more holistic, more of an integrated wellness type approach, thinking even Western medicine, Eastern medicine, allopathic, natural / lifestyle. So being a little more open and complete, just another word to say holistic. But I think it's just added some dimension to
Mhm.
it, kind of like Jennifer said too. You know, you're not just in this box where this is your diagnosis, you need to give them a home program or just treat what they came for, but you get to kind of, the flower kind of gets to blossom. You can just see it opening where they get to feel really listened to. So I think listening is another big piece of that too. There's a little more time, a little more sharing there, and people are drawn. It's very quick to build rapport with some of the skills learned from FMCA.
Mhm. And can we just, I just want to go one step deeper with that. Do you mind just sharing a little bit about why that's so important to build that rapport and that trust?
Certainly, I think of it as it's almost like in them allowing you onto their team, so then you can work together to get them better and to help them really embrace their wellness and their health and be more accountable and open to suggestions and collaborating together.
And with that, and this is really a question open to anyone, have you seen your clients, your patients go farther because of collaboration together?
Yeah. Yeah, I definitely have. I mean, rapport is such a critical piece, and you always talk about it when you're like in school and whatever training to be in whatever therapy. But using the coach approach, just it gets like Teresa said, like it gets you there faster, but it also gets you like much deeper. Especially when I was working in inpatient programs, like I usually only had, you know, it might be 5 days I would have with them, so it's pretty quick to be making any sort of treatment with them. But because in, you know, 15 minutes, by just actually listening to them, as opposed to being like probably a lot of the other practitioners that are kind of like come in with their piece of paper and it's like tick 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 tick. um I sat and listened, and they're all of a sudden, yeah, you're on their team and they're like, whoa, this person cares about me. And so they actually start to talk to you. And I learned, I would go to case conferences and tell like my team all these things, and they're like, how are you getting that information? And it's just like,
Mm.
because I'm listening to them.
Yeah.
So it
Wow.
made a huge difference.
Yeah.
Yeah, absolutely. Absolutely.
I'd
Um,
like to add to that too, if you don't mind, is
Teresa?
I think of it like the love of learning. Like I feel like once you get them involved, then they start to do some research and you can facilitate that a little bit. So they become more of an active member of their team, maybe a little less fearful of medical authority.
Sure.
So they may be more comfortable asking questions and working within their team instead of having like the fear of authority.
Yeah, yeah, absolutely.
Yeah, I'd just like to add to that, I keep thinking of meeting them where they're at,
Mhm.
giving that time to kind of get to know them and figure out, are they ready for this huge plan that they were given, or maybe they need to break it down, but figuring out where they're at first and then moving forward from there, I think is really important.
Yeah, absolutely. Thank you all. And so, as you are continuing on in your practice or starting to integrate your coaching skills into whatever you're doing right now, and you're visioning out into the future, what types of opportunities are you seeing possible for yourself, for your clients, your patients that you're working with? Who would like to share? Jennifer, would you like to?
Yeah, I was going to say crickets. Yeah, lots of I think there's a ton of opportunity. I like being able to tie kind of like, especially even I guess with like I do work with athletes that are retiring. Often that's a forced retirement. So like from the recreation therapy standpoint, it's kind of a weird population, but it actually ties quite closely and is very similar therapy to working with rehabilitation. I find it's very, very similar. I worked in spinal cord injury for a number of years, and so being able to, it's similar in the sense that they, how do we put this? Yeah, so like they've lost something, and a lot of athletes are retiring because of injury, and so it might not be as serious, but they can't do the thing that they loved anymore. So being able to kind of work with that, it's just a different area that I don't think a lot of therapists are thinking about, and just being able to connect. Kind of make that connection. And with like the coaching side of that is again that listening piece, like we kind of just talked about. So it's a hard thing. Like they aren't feeling heard. They might be seeing like just your standard, say, physiotherapist to work through to make sure that they can actually function, but to actually be heard and figure out what is going to work with their life is really crucial. So I don't know. I feel like it's just another opportunity or another place that I hadn't even thought of that I've kind of tapped into. Has been really fun for me, and I'm loving working with that. So, yeah.
Oh, yeah, I can sense your passion for it. You're sharing. Jessica, how about you?
Yeah, I see huge potential in my community as far as bringing the idea of personalized lifestyle medicine and, that operating system of functional medicine to the community. It lends yourself to ask a certain set of questions that might be different than, conventional medicine. And then that leads to a different set of answers, which allows the clinician to provide maybe a more personalized precision intervention. And so as a health and wellness coach, I'm that aid to gather that information and help that client execute, that plan that's more precise for them.
Yeah. Wonderful. Thank you for sharing. Teresa, how about you?
So when I think about future opportunities for myself and my patients, I actually think of more of the same of what I'm doing. It all feels good. It seems to work. And I'm frequently working on balance and thinking about present and future. And so I'm 56. I've been doing hands-on for a lot of years. And so one thing I had in mind with health coaching was a bit of a transition, and not fully, but just to create a better balance so I can work longer, which is what I really want to do. So to be able to take care of myself also. And a couple specifics would be maybe a second edition of my book, Create, Eat, Sleep, Poop, and Move. So to edit that and create a second edition, and then also continuing to do more community programs, informational sessions, but also group meetings and wellness workshops.
Yeah, wonderful. So there's a lot of different opportunities out there, and more to come, which I think is a great place to bring in that strength of creativity as well. So as we transition and flow into our final question here, what would you say to someone who's a new therapist who's looking to become or layer on this skill of health coaching? What piece of wisdom or what would you share with them as they're looking for a program that might suit their needs? Teresa, would you like to start us off?
So when it makes me think about some of the people that I've talked to that you've referred to me to talk about FMCA and whether or not it was a good fit. And that's been really fun. I enjoy doing that. One of the questions is now the time? Like, when is the right time to do this? And so when I thought about that question, what comes up for me is any time is a good time. You'll always learn something, both personally and professionally. And it will only, I'd be surprised if it didn't, but I can only imagine it will only enhance who you are personally and who you are professionally and what you have to offer.
Thank you. Yeah. Now is the time, right?
And yeah, any time is a good time. Like, why wait?
Exactly. Thank you. Thank you. Jennifer, how about you?
Yeah, I'm on a similar page. I think like as a new professional or somebody that's just graduating, there's some things that are overwhelming maybe in the first, like, I don't know, 6 months to a year, just like learning how your position works and those kinds of things in whatever setting. And if that feels too overwhelming to take on, like that big learning piece with taking coaching school as well, then maybe not, like maybe, wait to your second year. But I think like I said earlier, most new therapists, their biggest fear is assessment. And within the first, I guess it's like 3 months probably of FMCA, you're really like hitting home that like motivational interviewing and all that kind of stuff, the coach approach, which is going to make assessments just that much easier, and being able to build that rapport and be a good part of your team and all that stuff. So if that's something that makes you nervous or something that you really feel like you need to work on, I think it's worth it to do it in the first little bit. But if you're really overwhelmed and settling in, just hold off for a little bit until you feel confident and then go from there.
Thank you. Thank you. And Jessica, how about you?
I would challenge anyone considering this program to consider stepping out of their comfort zone. For me, I'm 48 and I was enjoying my job, but because of what was presented to me, I challenged myself to figure out what would help this community. And it's been really beneficial. It's been, a roller coaster of emotions. But in the beginning, and I've kept this sort of mission statement to myself, is the reason I got into this is to continue that conversation, why this is important for the community, that intrinsic motivation, if I should reference some FMCA curriculum, really helped me get through and, be able to put together those monthly summaries for my group of people at my work that have supported me, to keep them in tune to what we're learning, but figure out that intrinsic motivation. What do you have in the community? What is needed? And figure that out for yourself, and then step outside of that comfort zone.
Yeah, beautiful. Thank you so much, Jennifer and Jessica and Teresa, for sharing your wisdom. We just loved hearing your stories and what you're doing. And for those of you who are watching or listening, we would love to hear from you as well. What's an insight or a takeaway or an aha moment that you may have picked up today as you're listening and tuning in? And maybe you are actually having more questions, or maybe you're curious, how can I take this coaching further? What would that really look like in my life? So either way, if you want to be part of this growing movement and community, there is absolutely a place for you here at FMCA, and we encourage you to reach out. You can actually head over to functionalmedicanecoaching.org/about/contact, where you can call or you can email us. You can actually speak to a Functional Medicine Coaching Academy grad. We are here to support you wherever you're at, meeting you where you're at, and just helping you to figure out what your next step might be. So please get in touch. And thank you so much for watching and listening. Of course, for our student and graduate participation, we really appreciate you and the work that you're doing, because it is so, so necessary. Thank you so much. Take care.